We are here with Amy Goldman, Resources for You from your State AT Act Program. Thank you, Amy.
Okay, you ready for me to go?
Yes.
All right, I'm excited to bring this information to our audience. Resources that you can use immediately. I was going to say Monday morning when you return to work, but we don't know what that looks like for everybody. Anyway, I'm Amy Goldman, and I am a speech-language pathologist and currently work as a technical assistance specialist for the National Assistive Technology Act Technical Assistance and Training Center, known as the AT3 Center, because if you take the first initials, Assistive A, Technology T, Technical T, Assistance A, and Training T, you get AT, or AT3. And there's my contact information. So hopefully by the end of the session, you will have a good understanding of the device demonstration and lending activities that the State AT Act grantees do to promote access to assistive technology. You'll be able to describe the state financing and device reutilization activities conducted by State AT Act grantees to promote the acquisition of AT, and you'll know resources for learning more about the AT Act program in your state and how to find that program. So a little bit about the Assistive Technology Act of 1998. So this is a piece of federal legislation, started out being called the Tech Act, and it was the first time that assistive technology was defined in federal law. And now every state and territory has a federally funded state AT program. The AT Act also includes an appropriation to the state's Protection and Advocacy Program. So you may know this, for example, as Disability Rights Pennsylvania or Disability Rights New Jersey. So the act went under significant revisions in 2004, and instead of calling it the Tech Act, whose long name was Technology-Related Assistance for Individuals with Disabilities Act, we now simply call it the AT Act. That act is very specific in terms of what each of these state programs must do. In addition, the AT Act provides for national technical assistance, and that's the AT3 Center for whom I work as a technical assistance specialist. The AT Act programs come under the U.S. Department of Health and Human Services Administration on Community Living. So what is assistive technology? You probably know this, but again, this is the first time it was defined in federal legislation. And I like to emphasize the fact that it's any item, as long as it is used to increase, maintain, or improve the functional capabilities of individuals with disabilities. So if you work in the schools, you're familiar with this because it's almost identical to the definition in IDEA, which instead of broadly individuals with disabilities, says students with disabilities. It includes mainstream technologies as well as specialized technologies when the device is used by a person with disabilities to increase, maintain, or improve their function. It can even include do-it-yourself as well as commercial products. It ranges from low-tech to high-tech. It is not, by the way, only AAC, which is sometimes a misconception that I've encountered in the field. One of the important things in the AT Act is it was very plain to specify that it's not just the devices, but it's also the services, including assessment, training, maintenance, and repair. Of interest to SLPs, their clients, and their families includes AAC, apps and software for literacy, reading and writing, amplification and hearing access, and telecommunications. So I always want to make sure that SLPs are thinking about, particularly in this century, telecommunications, not just face-to-face communications. So as I mentioned before, the AT Act is very prescriptive, and it requires certain activities to be done by each state and territory program to help provide access to assistive technology, primarily to help people with disabilities make a decision if AT devices and service will help them, and perhaps which ones. Now, this is not a replacement for assessment, but in a sense, it is introducing the AT to the client. So short-term device loan, to help people make a decision, they can borrow equipment to use in their own environment. They can borrow it to help make that decision. They can borrow it while their own device is in the shop, while they're waiting for funding, which we know can be a lengthy process, for short-term accommodation or for professional development. And we have had, particularly in the time of COVID, people borrowing iPads with apps because they could not communicate via voice. So that would be an example of a short-term accommodation while they were intubated. The other access required activity is device demonstration. And this is when an AT expert, an employee of the AT Act program, compares features and benefits and helps the consumer determine if the device might be useful to them. This is not a salesperson, or it is not a salesperson alone with a consumer. And it, as I mentioned before, it's not an evaluation, but it may be followed by referral for evaluation. So those are our access activities. The AT Act program also requires that states engage in activities that help people with disabilities acquire the AT that they need. This includes state financing, such as cash loans or other activities, and reutilization. And I'll be delving into these activities more with some examples from some of our states, including Kansas, Pennsylvania, Missouri, and Delaware. So you'll get a full idea of what these activities might include. So some state AT Act programs administer their state's Telecommunications Equipment Distribution Program. So it is worthwhile for you to know who that is in your state. It may be the state AT Act program, as I mentioned, but there is also a membership organization of these programs called the Telecommunication Equipment Distribution Program Association, www.tedpa.org. Why do you need to know about these programs? Because they give out, often there is a lower income requirement, but they give out amplified phones, caption phones, and more smartphones or tablets, and even speech generating devices, depending upon state guidelines. So I didn't mention it yet, but I'll be mentioning it. I will mention it now, and I'll mention it later. If you're wondering, how do I find my state AT Act program? go to www.at3center.net/state program. And there's a directory there where you can search for your program and also for specific contact information on those 4 required activities. So let's talk a little bit more about device reutilization. This is amazing. Most of the 56 AT Act programs have one. Remember, I said every state and US territory. Reutilization might include a classifieds. It might include a system whereby devices no longer used are taken in, cleaned, maybe updated software, and given out. And in the last federal fiscal year, 19, for which data is available, across the country, almost 58,000 people acquired more than 78,000 reused devices. Most of these, many of these, were given to them free or at low or very, very minimal cost, saving consumers, I have a decimal and it should be a comma, over $30 million. And many people who received the reused devices said that they would not have been able to get it from any other source. So a little bit more drilling down about state financing. Again, in our last fiscal year, we had 945 people who got a financial loan to purchase almost 1,000 devices that they ordinarily wouldn't have been able to pay for. Almost $9 million in AT purchases. Most of the people borrowed money for hearing aids and adapted vehicles, although some borrowed money for speech generating devices, tablets, or uncovered items. There's usually a favorable interest rate. So for example, a state program might make a deal with the bank. If the bank ordinarily charges an interest rate of 4.5%, the state AT program buys down the interest. So now it only costs the consumer 3.5%. Some states also have mini loan programs where if what you need to borrow is under $500, the state AT program will give you the loan and you pay it back in monthly installments at 0% interest. Sounds a lot better than charging your iPad or your app on a credit card. Some of these programs also have credit building and financial education initiatives to help make sure that people with disabilities become or improve their credit worthiness. So there are other activities, and here are some of them. I mentioned the telecom distribution programs. Some of our state AT programs administer last resort funds that come either from the state or from private fundraising efforts. And more, we're doing some fabrication. So 8,000 devices provided to over 6,600 recipients, saving them $880,000 and change. So what are some of the other required activities? Public awareness, making sure people know about assistive technology and know about the resources of their AT program. Pre-COVID, many of the state programs either had their own AT fairs or participated in state exhibits and fairs. They provide information and assistance. They all have robust websites, emails, and of course, phone. They provide training. It's not so much training for the end user in how to use the device, but rather training for professionals. So examples of training might be, how do you include AT in the IEP or in the individualized plan for employment? How do you walk through consideration of AT for a client who has come to the area agency on aging for assistance? The state AT programs might also provide technical assistance. For example, if the state is trying to develop a Medicaid waiver and wants to know the best way to define qualifications for an assistive technology provider, the AT program might help. There is a special emphasis on assistance in the area of transition, as well as accessible information and communication technology. So you should also know that these programs are meant to be statewide, cross-age, cross-disability, addressing the consumer's needs in education, employment, and community living. Each program has a state AT advisory council or committee. And in particular, if you are a family member or an AT user, you might want to reach out to your state to see if they have a vacancy for a consumer or a family member. And then you can engage actively with how your state's program works. So here's kind of the kicker, that this is a federally funded program, but the federal grant is relatively small. And the average is about $500,000 for a state. And again, the state has to be statewide, cross-age, cross-disability, addressing education, employment, community living, and doing all those activities that we went through before. Now, some states have done a really good job of leveraging other funding sources. So, for example, the Illinois State AT program actually has an operating budget of about $5 million. So I'm going to talk a little bit about Pennsylvania. And I was really privileged up until 3 years ago to spend 25 years directing the Pennsylvania program, which at the time was called Pennsylvania's Initiative on Assistive Technology and is now cleverly named Tech OWL, Technology for Our Whole Lives. And I encourage you to visit their website, particularly if you're in Pennsylvania. So one of the things about the State AT Act programs, there's a different lead agency in each state. About a third of the lead agencies are at the state's University Center of Excellence in Developmental Disabilities. About a third are in state agencies like the State Vocational Rehabilitation Agency or the State Department of Education. And about a third are in nonprofits. So remember I said we have to serve the whole state. Well, how do you do that in a state like Pennsylvania or some of the other bigger states? In Pennsylvania, there are 8 regional assistive technology resource centers. And those resource centers do almost all of the activities that I reviewed before. Pennsylvania has a lending library that is supported through state as well as the federal funds. And there is both a centralized program and some regional on-site lending at the ATRCs. The good news, it's free. There's a range of products by function: hearing, vision, speech, communication, a range of products useful by people with different ages. Who can borrow? Any Pennsylvanian with a disability, their family, or a service provider. In Pennsylvania, most of the program is prepaid UPS delivery and return, hence the image of our friendly UPS person. The length of loan, typically 3 to 4 weeks, might be less, depending if there's long waiting lists. Now, the state AT programs may not provide supports to the borrower and may encourage the borrower or assist the borrower in finding supports if they're not already connected with the AT services that they would need. Other AT initiatives in Pennsylvania, device demonstrations. Remember, those are the guided explorations where there's somebody, not just a salesperson, helping the consumer understand features. Information and assistance. So where do I find a vendor for this app? What's a funding source for this speech generating device? Where do I find, or what are my options with mounting systems for iPads? Pennsylvania also has done a considerable amount of work around emergency preparedness. And they have several options. The links are there. And in particular, they developed a core board useful in this time of COVID. In Pennsylvania, as I mentioned, our ATRCs are collecting, cleaning, and redistributing gently used AT. A very cool initiative currently at the headquarters for Tech Owl is the collection of used tablets and smartphones that are then cleaned both physically and electronically and redistributed. It's been quite a program that has helped people who have been so socially isolated, particularly during the pandemic. As I mentioned before, the Telecommunication Device Distribution Program in Pennsylvania actually is administered through Tech Owl. And it's not just people with hearing impairment. It's any disability that interferes with telephone access. And a couple of years ago, they started offering wireless devices, including tablets and AAC apps. So pretty exciting and a great resource for people who need those technologies. Pennsylvania also did a making initiative, fabricating custom solutions for kids out of cardboard. So we're going to leave Pennsylvania for the time being and head on west to Kansas. So here is the link for Kansas. I don't know if we have any Kansas online, but that's atk.ku.edu. And the lead agency there also happens to be the University Center of Excellence in Developmental Disabilities at the University of Kansas. They've got 5 what they call access sites. Pennsylvania called it Assistive Technology Resource Centers. So we're going to focus for a moment on what Kansas does with durable medical equipment. And keep in mind that even though you're probably SLPs, but maybe you're a family member, think bigger about the AT needs of your clients. So, if you're dealing with individuals who've had a stroke, you may be, if you're thinking big, think broadly about that individual's need for a bath chair, a backup walker, a backup wheelchair. So Kansas has a very well-developed DME reuse program. And they actually have 3 kinds. One is a device exchange, sort of a classifieds. One is where they take in the donated item, refurbish it, repair it, and give it back out. And the third kind is an open-ended loan. where you can have the item as long as you need it, but then there's an expectation that the item will be returned to AT for Kansans. So again, I mentioned before all the great savings. They're frequently requested items, AAC devices, manual and power chairs, scooters, vision and hearing devices, just about anything. So again, a resource for you to find gently used devices, including speech generating devices. Here's that link again for your to find your state AT Act program. It's actually at3center.net/state program. We're moving down to Missouri, or across from Kansas, I guess. And Missouri is called MOAT, Missouri M-O-A-T. Again, this is one of the confusing things, is the state AT Act programs each have their own name. The lead agency in Missouri is an actually governor-appointed council. So they've got a budget that's about $4 million. So the federal funding is the smallest piece of their funding. They've got 13 regional sites. They do an annual statewide AT conference. Of course, they're probably going to go virtual this year. And their website is at.mo.gov. So I'm going to talk a little bit more about the Missouri Telecom Access Program. So, as in many other states that have these programs, it is funded through a surcharge on telephone users. It provides adaptive devices for telephone access. And this is unique for Missouri, adaptive computer devices for internet access. So again, think about your SGD users who also need adaptive computer devices. As I mentioned before, Missouri and other states are more and more including wireless options in their programs. Unfortunately, most of the programs do not pay the monthly service fees. They do pay for the devices themselves. Eligibility for these telecom access programs varies by state and is usually lower income. So in Missouri, it's less than $60,000 for an individual. Missouri serves all people with disabilities in their telecom access program, as does Pennsylvania. But other states are more limited. Like I believe Florida is only hearing impaired and deaf. The program provides devices needed for access, but as I said, not your data plan or your telephone service or your internet service. So other state financing activities in Missouri. So Missouri manages a reimbursement program that helps schools with the AT purchases. And that's funded through the Missouri Department of Ed federal funds that are siphoned to the Missouri AT program. Missouri also has a program funded through special healthcare needs, which purchases adaptive devices for kids with special healthcare needs when the device is not covered through other insurances. Moving up to Colorado. So Colorado's AT program is at the University of Colorado in Denver in an entity called AT Partners. So they're highlighting for us today their work with EI, early intervention. So they found that there were challenges in providing AT for young kids. They had an expert model, the AT expert from 50 miles out of town, and they found that that was really not effective, that was not helping to get AT for young children. That rather, there was a need for knowledge among all EI providers about the scope and benefit of assistive technology. And knowing that with early intervention, there's a narrow window of opportunity to really make the biggest difference. So the goal of this program, run by the state AT program, was to develop an infrastructure to support early, consistent, and effective implementation of AT services in Colorado for young children. Now, I did do some work in Pennsylvania in EI and found that the typical age of referral for AAC was between 4 and 6 months of aging out of the Birth to 3 program. And we know, if we're an AAC person, that that's too late. So Colorado recognized that we might be missing key windows of opportunity. So their new plan was to have just-in-time web-based training and resources. So I encourage you to check out tykes.org to check out their training and resources. Marketing and communications have more devices in their loan program and a way to incentivize and develop more local consultants. The EIAT consultants are point of entry for the lending program. So if you want to borrow, you go to your EIAT consultant, so more local. So that person communicates with the state, helps to access ongoing training and support. And I thought this was very cool. Those EIAT consultants help to negotiate a higher rate for AT services, something near and dear for all of us. So what they found was huge positive changes in device use, both for speech communication, learning, recreation, mobility, environmental adaptations, and electronic aids for daily living. So huge change, particularly in the area of access to speech communication devices. Moving back to the Eastern Seaboard, I'm going to talk a little bit about AT Act resources and aging in Delaware. So you see that many of the states have special initiatives with certain populations, and in fact, may have been able to leverage additional funding for those initiatives. So Delaware is called the Delaware Assistive Technology Initiative, or DATI, or DATI. It's also, coincidentally, housed at the University Center of Excellence in Developmental Disabilities, which is called the Center for Disability Studies at the University of Delaware. So DATI looked at the needs of the state and how important AT is in aging in place and aging with dignity. So home modifications, vision, hearing, communication, of course, and activities of daily living. As I mentioned before, our programs pre-COVID did a lot of exhibits to help increase awareness. So for example, senior fairs, you might see an exhibit like this, health fairs, etc. Information resources. So many of the states will have informational resources on their webpage that you could download. So again, in Delaware, instead of the schools maintaining an inventory of equipment that sits on the shelves, there's a centralized lending program that also has devices available for demonstration. So schools don't have to keep those inventories themselves in the closet. I'm sure many of you may have gone into a school newly assigned to you and found a closet full of stuff, including some ancient stuff that has just been sitting and unused. So having a centralized loan program like DOTI helps to avoid that waste of funds. So DATI also has a focus on accessible instructional materials. So something that particularly if you're engaged in literacy for your clients, you should understand accessible instructional materials, what it is, how to get it in the IEP, and how to access digital content. So again, in Delaware, we have lots of training and technical assistance options, similar to other states. I know in Pennsylvania, they just did a series of 3 AAC 101 webinars. And of course, in this time of COVID, many of these events are taking place online and they are free. Delaware also had or has a program of fabricating low-tech AT. Ever think you might need a stand for your iPad or your client's iPad? No need to buy it, easy enough to make it. And an interesting thing about their model was that they used volunteers from the community to do the fabricating. Thinking about all the talented retired engineers, the people who are good with sewing machines, retired architects who are good at solving all kinds of problems. So the Delaware program also has an AT exchange classifieds listing that helps get gently used and still functioning equipment to students and their families. And the Delaware program also coordinates the professional learning community for all AT personnel across the state. And again, it's not just education, it's also helping families. So some resources for you, at3center.net, and you're going to go there right away, at3center.net/state program, and find your state program if you don't already know it. The Center for Assistive Technology Act Data Assistance, or CATADA, is a repository of the data collected and reported to the Administration on Community Living by each state program. But if for example, you're from Nebraska and you wanted to know, well, gee, how does the number of devices borrowed in Nebraska for speech communication compare with the number of devices that are provided nationally for speech communication? You can run that kind of customized report. The Association of Assistive Technology Act Programs is a membership organization of the state AT Act programs, and the Administration on Community Living. As I mentioned, that's our federal agency. So I don't know if there are any questions. I see one in the chat.
Yes, I put one question in the chat from Heather.
Okay. So one of the things that, so Heather's question is there somewhere to find out not just who to contact for loan assistance, but funding opportunities or grants for students who cannot get an expensive device through insurance? So that's a great reason to contact your state's information and assistance program, because hopefully they are familiar with both local and perhaps national resources for funding. So great question, Heather.
Survey link.
Any other questions? Okay, well, in that case, we'll give you back to the rest of your afternoon or evening, depending upon your time zone. And again, this PowerPoint is available. And thank you for attending.